Sige. So let's continue our discussion sa chapter 12. We have drugs for epilepsy. We are done discussing last week about the different types of seizures, and then we are also done with our discussion set drugs na to for partial seizures and for generalized tonic-clonic seizures. So, yung topic ko about phenytoin hanggang pyruvinamide are all drugs. They are all drugs that we can use for the treatment of both partial seizures and for generalized tonic-clonic seizures. Now, we are down with the last group of drugs na pwede nating gamitin, but this time, this is purely for generalized seizure.
Ma'am, wala ka pong audio.
Nawala ang audio mo, ma'am.
Now,
Wala pa rin, ma'am.
yari.
Naan na, ma'am.
Naan na. Adjust na. Can you hear me?
Okay na, ma'am.
Okay, sige. Okay, let's start with our first drug used for generalized seizure, specifically for absence seizure, or that's what we call the pipitmal. Okay, so this is our drug of choice. We call it ethosuximide. The brand name in the market is Zarontin. So it is introduced as a drug for pipitmal only, for our absence seizure. So ano ni siya? This is a favorite board exam question kasi drug of choice siya. Generalized seizure ang pipitmal, okay? Pero dili na to pwede gamiton si ethosuximide to other na mga partial seizure, okay? Mechanism of action, it's on the calcium current or the calcium channel. I-block na niya class ang calcium channel. The calcium channel is not really directly involved in the action potential. However, remember that the calcium is very important in the release of our necessary and important na mga neurotransmitters. So if you can still remember our discussion about the synthesis of both acetylcholine and norepinephrine, we discussed there that before these two neurotransmitters can be released from the vesicle or from the storage, kailangan ng calcium influx. Therefore, sa ethosuximide class, ang kanyang target is the calcium channel. I-block na niya, leading to the decrease in the release of those neurotransmitters. And bakit siya drug of choice for absence seizure? Kasi when you look at the pathophysiology of absence seizure, mas ang effect niya is more on, the problem is more on the calcium influx. That is why if we inhibit that using this drug, mas mas effective gid siya for absence seizure. So if the drug targets the calcium channel, we call it low threshold current. Our high threshold current involves potassium and sodium, but actually we have a high voltage calcium channel. But for absence seizure kasi, it's more on the low current or low threshold current na calcium channel. So that's what we block when we administer ethosuximide to our patients. So do not forget ethosuximide is our drug of choice for pipitmal or the absence seizure. So just like other anti-seizure drugs, toxicities are almost the same. We have kaning gastric distress. This is actually true for most of our drugs. There will be pain, there will be nausea and vomiting, and then transient lethargy, that's the feeling of kanang kapoy, weakness, or even fatigue. And then headache, dizziness, again, that's common, but we just have additional na toxicity symptoms for ethosuxamide, we have hiccup, magsibok siya sa Bisaya, and then we have euphoria. So it's the feeling, kanang feeling na high kay ka or naa ka sa cloud nine. Okay? Questions about ethosuximide class? Clarify something? Wala. Okay, so let's continue. We have our fensoximide and methoxamide. They're actually analog gihapon sa ato ang ethosuximide. So they still belong to the phenylsuximides. That's the name of the group. Okay? But actually, before pa si ethosuximide na-develop or na-discover, nauna na sa market si fensoximide and methoxamide. And just like the ethosuximide, ginagamit gihapon sila for our absence seizure. The advantage of the methoxamide is pwede siya for our partial. So not just with the absence, but pwede for partial seizure. However, later on sa studies, when they discovered the ethosuximide, it is more potent, it is more effective. Thus, kahit nauna sila sa market, hindi na sila ngayon ang ating drug of choice. So I hope that is clear. Okay? Next, we have the third drug. We have the sodium valproate. Our brand name in the market is Depakin. Pero meron tayo class valproic acid also in the market. You have to know the difference kasi Depakin is sodium valproate, naka-salt form siya. While the brand name in the market for valproic acid na very common is the Depakote. Okay? So please take note. Depakin is for the salt form sodium valproate, and ang valproic acid in the market is Depakote. Though the same use lang sila, the same mechanism of action, naka-salt form lang talaga si Depakin. Now, similar with other anti-seizure drugs, the mechanism of action is still on the blockade of the action potential or the firing of the neurons. So sodium valproate still blocks the high frequency firing of our neurons, and with additional use and the modification of our amino acid metabolism. Okay, but it's more on the firing of the neurons since it's our problem with seizure. We have high frequency firing na paspas na kaayo ang paggawa sa impulse na dili na siya kaya habulon sa ato ang body. Thus, na ay mga signs and symptoms like there is tonic and clonic na mga muscular contraction. Okay? Wait lang ha. Sige, let us continue. Let's have the clinical uses of our sodium valproate para asa siya. Since we are talking about generalized seizures, so mag-expect jud ko, then dapat kabalo mo na para siya sa mga different types of generalized na seizures like the petit mal, the generalized tonic-clonic seizure. When you say petit mal, absence ha. Okay? So, especially if the absence seizure is na ay kanang nauwi na ganina siya sa generalized tonic-clonic seizure. So, na ay concomitant na grand mal. So, petit mal plus grand mal, and then myoclonic also. And generalized tonic-clonic seizure is still the grand mal. Now, aside from that, valproic acid has also found its clinical use for bipolar disorder. So remember class na sa bipolar disorder na ay depressive phase, na ay mania na phase, wherein the mania phase is it's a psychotic episode wherein the patient feels like naa siya sa taas, sa cloud nine, taas kaayo ang iyahang what do you call that? Ang kanang feeling niya is kanang extreme. So there is anger, That is also due to grabe na firing of the neurons. So that is why valproic acid also can be used for the bipolar disorder. And just like topiramate, valproic acid is also a drug used for prophylaxis sa migraine. So pag mayroon ka og prophylaxis, it's prevention sa migraine attack. Do not forget that when you say migraine, na ay effect po din ha ang overfiring of the neurons, and then if ato ang i-inhibit ang sustained firing na pain signals can also be inhibited. Therefore, kung dili makaabot sa brain nato ang pain signals, then walay ma-recognize na pain ang ato ang brain. Mo na siya nga pwede siya gamiton for migraine prophylaxis. Now, just like other anti-seizure drugs, valproic acid is also considered a toxic one. Low ang iyahang therapeutic index, wherein the therapeutic level or the plasma level is 50 to 100 micrograms per ml. So mauna siya ang ato ang therapeutic level. Now, since toxic siya, let's talk about the toxicities. Kaning, first one, this is common to drugs, but kaning mga weight gain, increased appetite, and hair loss, this is not really common with anti-seizure drug. But for valproic acid, there are evidences that it can cause weight gain due to the increase in the appetite of the person, but it can cause hair loss, it can cause liver injury or liver disease. When you say thrombocytopenia, cytopenia means magbaba ang count or sa cells or magbaba ang level sa thrombocytes or our platelets. And then later, I will discuss what spina bifida is kasi I believe it's not common sa inyo, ha? But valproic acid can also cause cardiovascular na mga toxicities and orofacial and digital abnormalities, especially if ihatag nato siya sa pregnant women. So pag ihatag nato siya sa pregnant women class, ang baby paggawas, pwede magkaroon og deformities. So pwede sa nawong, pwede sa baba, pwede siya magkaroon og cleft palate ang atuang baby, or pwede magkaroon og digital abnormalities. When you say digital abnormalities, ang iyahang mga fingers. So pwede nga makulang, pwede sad masubra, kasi there will be mutation. So valproic acid class is considered teratogenic. So makaharm siya sa fetus. So we don't give this for pregnant women. And aside from that, aside from the orofacial abnormalities and digital abnormalities, our valproic acid can also cause spina bifida sa atuang baby kapag ihatag siya sa mama while nagabuntis. So other name for spina bifida is spinal dysraphism, or there is severe malformation with a flattened, disorganized segment of the spinal cord associated with an overlying meningeal outpouching. So ang nahitabo man gud ani pag ang mama buntis nag-take og valproic acid, makahinder ang valproic acid sa development sa fetus, especially sa part sa I forgot the name. Naay part sa fetus nga mauna siya ang mag-develop sa brain ug sa spinal cord sa bata. So habang class nagadako ha, diba, we have the embryo katong fertilized egg. So naay part din ha sa embryo nga habang nagadevelop siya, padulong siya didto mahimong spinal cord ug ang brain. Na mao na siya ang maapektuhan sa valproic acid, specifically on the spinal cord. Okay? So naay tulo ka klase nga spina bifida na pwede mahitabo sa bata pag anak sa iyaha. So pwede spina bifida occulta. This is actually an asymptomatic bony defect wherein ang sa spinal cord niya class naay defect gihapon ang bata, pero asymptomatic siya. So dili kaayo siya makitaan, murag ano lang siya, parehas lang siya ani kaning picture na nasa baba. Mura lang siya dimple, ang uban kay na ay buhok, pero actually it's a sign nga na ay spina bifida occulta ang baby. Pero wala na siya symptoms, walay bation ng baby ana. Unlike sa kaning duha, the I forgot the meningocele and the myelomeningocele. Okay. Ang pinakalala this one, myelomeningocele, wherein magkaroon jud og problem in the development of the spinal cord of the infant, tapos naagyud siya mugawas. Kani actually kaning picture sa baba sa right side, ni siya ang myelomeningocele, wherein since wala nag-develop og tarong ang iyahang spinal cord, mugawas na siya class. So makita class ang mga tissues na nakapalibot and makita pod ang uban nga nerves. So ano na siya very risky for the infant nga wala naka-cover ang part sa iyahang spinal cord. Actually, nahinumduman na nako, it's a neural tube. So sa embryo natay ginatawag og neural tube, mauna siya ang mag-develop into the brain and the spinal cord of the infant. So spina bifida is an example of a neural tube defect. So what happens to the infant nga na ay spina bifida? Actually, maka-function siya tarong, especially if the spina bifida is just occulta, kasi wala man ni siya asymptomatic bony defect man ni on the spinal column. But if kaning duha, meningocele and the myelomeningocele, pwede class nga may problem with walking, with standing, pwede nga there will be muscle weakness. And since the tissues are exposed, the nerves are exposed, then the baby here as he grows up, at risk siya of having several types of infection. So among other na symptoms na pwede niya or complications na pwede niya ma-experience. So mao na siya class nga as pharmacist you have to know that valproic acid and even the sodium valproate is category X when it comes to pregnancy. So dili gyud nato siya ihatag. Okay, sa mama na buntis, kay pag anak sa bata, maingani na siya. Pwede. Kasi, pwede siya, Janica. Kasi, kapag naay spina bifida ang infant paggawas, kailangan ni siya og constant na care from the physician. So, alagaan lang ang baby ani nga para ma-lessen ang mga complications like infection and kanang problem niya with walking or standing or paggamit sa iyahang mga lower limbs, sa iyahang tiil. Okay? Pero actually, pag na-spina bifida, dili necessary nga mamatay na sila dayon, no? Na ay mga persons with spina bifida na mabuhi man sila og dugay as long as ma-lessen ang complications. Okay? Questions so far, class? Actually, they can undergo surgery. So, depende kasi siya sa case sa infant. Na ay mga doctors, daghan klaseng doctors ang kailangan ani, surgeon, neurosurgeon, kay remember it's on the spinal cord. So this is very delicate kay ang mga neurons ani exposed and kailangan manggod siya ayuhon through surgery. So yes, pwede siya na mag-surgery, mag-undergo surgery ang baby. So luwi lang kayo sila class kay bago pa lang silang gianak, naana sila defect and mag-undergo na sila og surgery tapos mag-anesthesia na dayon sila. Okay? So as much as possible, dili ta mo hatag og sodium valproate sa atuang pregnant women. But take note class, it's not just sodium valproate that can cause spina bifida. Other cases also na experience sa buntis, pwede class magkaroon og spina bifida ang bata. For example, kanang nagbuntis nga na ay diabetes, taas ang sugar. Actually, pwede na siya nga magkaroon og risk pod for neural tube defect ang baby. O kaya kanang during pagbuntis class, maka-experience og fever nga taas kaayo ang mama. Karang taas kaayo nga fever ha, taas kaayo yung temperature. Actually, it can also cause spina bifida sa anak. So again, this is not solely because of the valproic acid. There are also other conditions, not just sa tambal, nga pwede mag-cause of spina bifida. Yeah, pag mag-grow ang bata, mag-grow pud na siya. Kana. Na siya buhok-buhok class sa gawas. Labi na sa spina bifida occulta, this one nakita ninyo. Ano siya, aside sa murag dimple na napod siya hair. Nagkaroon og outgrowth na nag-protrude sa likod sa or outpouching ang tawag ana. Meningeal outpouching. Remember class, when you say meninges, it's actually the covering of our brain and the spinal cord. The problem here, since wala nag-develop og tarong ang ilahang spinal cord, nagagawas ilahang meninges. So exposed ang tissues and ang mga neurons, nerve tissues. Murag vagina nga nag-invalid sa mukha. Pwede pa din nga to sa mukha. Pero class, sa sunod, kay mga babae man ta din hitanan, always remember na kanang pag magbuntis ta sunod, magbuntis man siguro ta sunod, no, kailangan very healthy ang mama para protected ang baby and wala siya defect paggawas. Diba, ingon ko, diabetes during pregnancy, and ang high fever or infection during pregnancy can also disrupt the, what do you call that, the development of the infant. So pwede siya magkaroon of neural tube defect like the spina bifida. Okay? So that's for the valproic acid. It's the third drug. Then we have the oxazolidine diones. Bakit may dimples ang puwet nila? The same explanation sa dimples na naa sa nawong. So kanang mga dimples, present sa dimples sa nawong or sa lubot man na siya is an indication of kanang wala fully na develop ang muscle. So kanang may mga dimple gani class, wala na natarong og develop ang ilahang muscles, mao na siya na nag-create siya og dimples. So the same explanation kung unsa na sa puwet nila. Okay? Next, oxazolidine diones. The first drug is called trimethadione, which is the former drug of choice for absence seizure. So again, karon ato ang drug of choice na is the ethosuximide, but the former one is the trimethadione, which is the first oxazolidine diones. Okay? Kanahan siya dimples sa lubot. At the problem with dimples, pag nakay dimples karon class, pag magtigulang ka, actually mas bisan pag dili ka mag-smile, naana na ang dimple kasi nagasag naman ang imuhang skin and naamang kay defect sa imuhang muscle. So maklaro na siya, mag-ana na imuhang nawong pagtigulang nimo. Mana siya underdeveloped pero makagwapa. Makagwapa day ang naay dimples. Okay, our problem with oxazolidine diones is the sedation. So let's talk about other drugs used in the management of epilepsy. So gikan kay class, ethosuximide hangtod kay oxazolidine diones, mo ni ang mga drugs used for generalized seizures. So especially the petit mal or the absence seizures. So napatay uban pa na mga drugs like benzodiazepines. Ang atong mga benzodiazepines class, originally, they are used as anxiolytic, sedative, hypnotics, just like our phenobarbital yesterday na na-mention ako. And I think I have discussed also the mechanism of action of both drugs, benzodiazepines and barbiturates. Diba? Their action is on the enhancement of the gamma aminobutyric acid, wherein when you enhance the activity of GABA, there will be opening of the chloride channel, leading to influx of the chloride inside the cell, and then ma-depress ang function sa cell. So both benzodiazepines and barbiturates are actually pwede. They are possible na mahimong drug for seizure kasi pwede sila mag-slow down sa ato ang cell functions. Whereas atong problem with the seizure is we have very stimulated neurons. So one example of a benzodiazepine is the diazepam. I don't know if you are familiar with this. Brand name is Valium. So for seizure class, we can give diazepam in the form of intravenous injection, or we also have suppositories na diazepam. So this is for stopping the continuous seizure activity, especially kapag ang patient has generalized tonic-clonic status epilepticus. So, di ba remember, pag may kag status epilepticus, mauna siya ang seizure na tuloy-tuloy, na more than 5 minutes class, wala paghihapon, na human ang seizure sa patient. Kasi mostly sa atong seizure, dili siya maabtan og 5 minutes. Pero after that, kapoy kaayo ang patient. Pag maabtan gani na siya 5 minutes, na magsige lang gyud siya og tonic, tapos clonic isa, di ba? Tonic katong mugahi, tapos clonic is katong magkirig-kirig na sila. Pag more than 5 minutes na wala gyud relaxation class, status epilepticus na ang tawag ana, and that is very life-threatening. Now, we can use diazepam here. We can inject via intravenous route, or we can give the diazepam rectally. The most common brand of diazepam in the market is Valium. This is a board exam question kasi ginapangutana na nila drug of choice for status epilepticus. Actually, the answer is lorazepam. But in the case na wala si lorazepam sa choices class, diazepam can be used for status epilepticus. So brand name of lorazepam in the market is Ativan. Okay? So si lorazepam and si diazepam parehas na sila nga benzodiazepine, and parehas pud sila og mechanism of action. Okay? Another benzodiazepine that we can use also for seizure is the clonazepam. So as you can see, meron silang similarity in their endings. The zepam, 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 clonazepam. Okay? But aside from status epilepticus, clonazepam can be used for other generalized types of seizures like the absence, the myoclonic, and the infantile spasm. Okay, and then we also have nitrazepam, which we use for infantile spasm and myoclonic seizures. And then this one, if the benzodiazepine does not end with the zepam, it may end with zepate. Okay, para ano lang, mas dali ninyo sila matandaan. Okay, we have clorazepate, brand name is Transcene. So this is approved in the United States as an additional treatment for complex partial seizures. But actually, kaning toxicity nga drowsiness, this is true for all benzodiazepine. Yes, Jai, tanan benzodiazepine, the same ang mechanism of action. It's on the enhancement of the activity of GABA. So it can result to the increase in the frequency of the opening of the chloride channels. So the same na ilahang mechanism of action, the same sila na ginagamit as anxiolytic, sedative, hypnotic, and there are also some benzodiazepines na pwede gamiton for seizures, just like what we have discussed, the diazepam, lorazepam, clonazepam, nitrazepam, and clorazepate. And actually, ang toxicity nila true for all also, kanang drowsiness, kasi sedative sila. So when you give this to a person with seizure, masidate jud ato ang patient ani. And feeling niya kapoy pagkahuman. That's letter G. Okay? But we have limitations for benzodiazepine use. Ang limitation actually mo nang wala siya ginagamit as a maintenance drug for our seizure is kanang iyahang sedative na activity. So as you can see, drug of choice sila for status epilepticus pero ginahatag ni lorazepam and diazepam during the attack, during the time nga naga-status epilepticus ang patient pero not not as maintenance drug kasi pirmi matulog atong patient ani kung mao ni iyahang maintenance drug. And our problem with benzodiazepines is the patient may develop tolerance. So after some time dili na matablan ang ato ang patient sa drug. So pwede na to nga i-increase ang dose, but ang problem na to pag may increase ang dose, remember nga the more taas ang dose, the more duol ka sa toxicity. Okay? So those are the limitations in the use of benzodiazepines. Okay, questions so far? Wala. So we are down with the last drug na pwede na to gamiton sa seizure. It's the acetazolamide. Brand name in the market is Diamox. So actually, original use of acetazolamide is diuretic ni siya class. So when we discuss diuretics sa PICOL 2 pa, kay ang diuretics para man sa cardiovascular system. So sa PICOL 2, ma-discuss gihapon nato si acetazolamide. So unsa ang mechanism of action ani niya? Actually, ang mechanism of action niya as diuretic and as drug for seizure parehas lang. It's the inhibition of the carbonic anhydrase. So unsa man na siya ang carbonic anhydrase? It's an enzyme class na it will break down the carbonic acid in our body, especially in our blood. I-break down na niya into bicarbonate ion and hydrogen ion. I-breakdown na niya. Siya ang mag-breakdown ha. Ang tawag nato sa enzyme is carbonic anhydrase. But if you administer acetazolamide in the patient, this will be inhibited. Therefore, carbonic acid will remain as carbonic acid, leading to mild acidosis in the brain. Remember, this is an acid, and if you have a lot of acid inside the body, it can cause acidosis. Naon sa ang iyahang role sa seizure? If your body or especially your brain experiences acidosis class, actually, it will result to the opening of the potassium channels. Pag mag-open ang potassium channels, remember, magpiso ka, magnesium potassium in, this is inside the cell. So daghan tag potassium nga naa sa cell. Once this potassium channels open, ang mga potassium nga naa sa sulod will go out. Mugawas na sila during acidosis ha. During acidosis, mag-open ang potassium channels leading to the efflux. Baliktad, papagawas siya. So mugawas ang potassium from the inside going to the outside. Kana. And pag magawas ang daghang potassium class tapos wala man ni sulod ang sodium, no, potassium raman ang nigawas. What will happen to the inside of the cell? It will become more negative. Okay? And remember, pag mahimo niya siya more negative, ang function niya ma-depress, okay, or mag-slow down. So that's the rationale why the diuretic acetazolamide can be used as a drug for seizure. Okay, I hope nasabtan to. Questions, class? We will have more of acetazolamide when we discuss the diuretics. Okay, but paano siya nag-cause of mild acidosis again? Inhibit niya ang carbonic anhydrase. That's the enzyme that will break down our carbonic acid inside the body to bicarbonate and hydrogen ions. Okay? Do you want to clarify something? Wala? Wala pangutana. That ends our discussion sa ato anti-seizure drug.